California has not been spared from the death, illness, and fear caused by COVID-19. But from forecasting models from the White House to this University of Washington one showing death projections, it's become clear that compared to states like New York, California's curve is flatter. Leading the way is Northern California's San Francisco Bay Area, which became the first region in the U.S. to order residents to stay home unless conducting essential business.
Indeed, we have been spared of the overwhelming surge that people were concerned about. So the real explanation is almost certainly that the sheltering in place that started in the Bay Area on March 17th at midnight, really first in the country, is doing its job.
Just days after the shelter-in-place order, we still found people not following the rules and determined to get in their workouts on communal equipment. Today, that outdoor gym has been fenced off, and it's clear residents are taking the order far more seriously. Cell phone data from Descartes Lab showed California users had dramatically cut down on their movement.
You see that quite dramatically in the West Coast. More recently, you've seen it on the East Coast as well. Actually, where that hasn't really decreased is the middle of the country. So one needs to be quite worried that the message has not spread there.
Today we announced.
On Monday, California's Governor Gavin Newsom felt confident enough to lend 500 ventilators to the federal stockpile for use in other states like New York. But some healthcare workers say the idea of a total flattening of the curve is hard to believe.
The testing is so limited and it's so strict that there is no way that is an accurate picture. There are people out there today walking around and they are staying in their homes and they are infecting. You know, we have families out there that are positive. There is no way we would know there are positives until we test them.
You can make some guesses and plan for worst cases, but the agenda here is that of the virus. We're followers. But social distancing will work. It's worked before. It's worked in 1918. It's what got the epidemic in China under control. It's what South Korea did.
Martin says the most telling information is how many people have died and how many people have been admitted to the ICU, a number that medical facilities often do not make public. So while Martin believes Northern California's healthcare system has so far been able to manage the influx, he says it's never easy to see the complete picture. Mark New, CGTN, Sunnyvale, California.